Hello, everybody. I'm Andrew Salciunas with 97.5 The Fanatic. You can catch me Monday through Friday on the midday show with Anthony Gargano, 10 to 2. And I absolutely love doing these. It's another edition of Doctor on Demand. I love my Virtua doctors. I've had so many incredible conversations with different doctors in different fields. And today is one that, look, it's tough, but it's something that we do need to talk about. And I'm with Dr. Linda Bascelli. She's an MD. She's a physician specializing in addiction medicine with Virtua Health. Today, we're going to be talking with her about substances and disorders and how we can best support our loved ones who may be struggling, especially with the upcoming holiday season, right? It's tough on anybody, especially with the holidays fast approaching. So welcome, Dr. Bascelli. Good morning. How are you?
Good morning. I'm well. How are you?
I'm doing great. Thank you so much for doing this with me today and for doing everything that you do on a day-to-day basis. You're truly an expert in addiction medicine with over 10 years of experience, which is incredible. You're helping patients find a path to recovery and working with family medicine for over 25 years. How have you seen the need for support grow with the COVID-19 pandemic? Of course, we've seen all kinds of stuff from the pandemic itself to inflation. I know times are tough. So what have you seen change in the last couple of years?
No, there definitely was change. People who had been stable in their recovery for a long time may have lost some of that stability around the pandemic, perhaps due to the loss of a recovery community and support while trying to figure out how to cope with the new and truly unprecedented stressors that came along with the pandemic. And people who had not had that demonstrated any risky use of substances previously may have turned to those substances maybe for comfort, as a way to cope with the stressors. We saw and we continue to see this in particular with alcohol use. People are increasingly seeking treatment for risky drinking behaviors that they had not exhibited prior to the pandemic. And I wish that there was no need for our services at all, but I am glad to see that people are reaching out for help and they're finding us, and MAT is an option. So many people aren't aware that there are medications that can help people achieve and maintain recovery if that's their goal.
So Dr. Bascelli, you guys have the MAT program. Can you touch a little bit more about that and what it is that you do?
Yes, sure, absolutely. So MAT stands for medication-assisted treatment or medication for addiction treatment. Evidence-based medicines are available that can help people achieve and maintain recovery. And medications can be useful even if someone's goal is not to completely stop their substance of choice, whether that's alcohol or opioids, but rather to be able to reduce the potential harm from continuing those substances. So along those lines, we welcome everyone, we meet people where they are, and we use this harm reduction approach, which essentially means that we don't require that somebody stop using their substance of choice completely in order to continue receiving our services or our treatment. And success looks different for everyone in treatment. And maybe somebody achieves and maintains abstinence from their substance. Maybe they adopt ways of using that are safer and the risk of overdose or death is reduced. So even if someone is ambivalent about their use, we are happy to see them, discuss options for keeping them safer by reducing harm by utilizing medications. And we see alcohol, we see opioids, but we also see people who are worried about their cannabis use, stimulant use, nicotine use. So we see all substances.
So just to get this clear, what is the difference between this and rehab or perhaps a detox?
Yeah, that's a really good question. So detox generally refers to the management of someone's acute withdrawal from a substance like alcohol or opioids. Withdrawal from a substance is very uncomfortable, and it's one of the most painful experiences people can go through. And in particular with alcohol or benzodiazepines, the withdrawal can be life-threatening. So it's really important that that's managed properly. That's usually done in the inpatient setting. Rehab generally refers to longer-term inpatient treatment that's focused on therapy, which can follow an inpatient stay for withdrawal management. So both of these things, detox and rehab, can play an important part in the treatment plan for an individual, but they're not cures for addiction. And to be successful, people usually need a connection. There's that word, connection, to continued care once they complete detox or rehab. So at Virtua, we provide outpatient office-based addiction treatment. So if you have heart disease, you're going to see your family doctor, you're going to see your cardiologist in the office for long-term management of that chronic illness. Just like that, we see patients in our office for the management of the chronic disease of addiction. So when someone is struggling, we may see them more frequently, but in general, people are able to go about their normal lives while being treated for their substance use. We meet people where they are. We take into account their work schedules, their family responsibilities when designing a plan for visits in the office.
Dr. Bascelli, with the holidays coming up, how can friends support those who are struggling?
So, they say that the opposite of addiction is connection. And sort of like what I said before, a lot of people really lost some of their stability during the pandemic because there was loss of connection. We weren't able to gather together. People who had received support in recovery groups couldn't meet anymore. So the lack of that connection really contributes to the severity of someone's addiction and their ability to actually begin their recovery or continue in their recovery. So it sort of makes sense that continuing to maintain connections and developing new connections when someone is seeking treatment makes a big difference for folks. And, I can't emphasize enough, part of our treatment here is to meet people where they are. So if you have someone in your life who may be using substances in a risky way and you're worried about that person, it really makes sense to just be present for that person. It's hard not to want to go about and fix somebody, but simply just that presence and continuing to engage with that person, talking about ways that they might be able to reduce harm without necessarily achieving full recovery is important. And then if that person decides that, gee, I really do want to stop drinking, I really do want to stop using, they know that you're a trusted individual, that they can go to you because you've accepted them the way that they are. You've remained connected despite this substance use. And that's the start. That's the start of recovery. So just being present for your loved ones, for your family, for your friends, really can be huge.
Now, that's very beautifully said. Now, let me ask you, if from me now to you, how can we get in contact with you? How can we all know somebody who is unfortunately struggling with addiction or is overdose? So how do people come in contact with you to find help?
Well, it's funny, actually. So, we have an office. You can call our number to make an appointment in our office in Virtua or our office in Lumberton. Most people find us through word of mouth, though. It's very interesting. People who have seen us and they've been treated tend to send other folks our way, which is nice. I think it says something about the care that we provide, and people trust us and they're willing to send their friends and family here.
That's really good to know. I mean, look, I've done a lot of these interviews with different doctors throughout Virtua, and every time I do one of these, I hear from somebody saying, "Oh my God, I had an experience at Virtua that was incredible." So to know that something as serious as addiction, as that we can come to you, Dr. Bascelli, and the team at Virtua, that's great to know, and it's great to hear positive feedback. So if you want to schedule an appointment with Dr. Linda Bascelli, who's been joining me today, and it's been incredible, at Virtua, call 856-322-3110. Again, that's 856-322-3110. Thank you, Dr. Bascelli. I really appreciate it. You educated me a lot on this conversation. You educated everybody who's going to be watching this. So we appreciate it so much. And I just want to know even more how we can support our loved ones struggling with substance abuse. And you've done that today. So thank you so much.
You're welcome. It was my pleasure.